Hey everybody, Dr. Rob Silverman here, Amazon best-selling author of Inside Out Health. I'm happy to be joining you today on a Tuesday. It's a new day that I'm doing a little social, took a little break, but we're back. Got some great information to share with you. Been really busy in the office with a lot of patients talking about immune health and immunity. Just had a couple of big webinars that I gave and got a really great response from my colleagues. And I wanted to share some of this salient information with you to the idea of really speaking about long hauler syndrome. So I want to share strategies and protocols for what we call long hauler syndrome and a little post-vaccine support. But I really want to emphasize the long hauler syndrome. Now, the idea of long hauler syndrome is interesting in that long hauler syndrome has been also correlated with what they call long COVID. So long hauler syndrome also is PASC, post-acute sequela of SARS-CoV-2. It's actually a diagnosis. It's in the ICD-10. And many patients have it. Many of my colleagues have it. It's something that we all need to talk about. And I just wanted to cover a few things. So PASC is an immune recovery. It's sort of complex in that there's a lot of release post-COVID of what we call TNF-alpha and IL-6 or interleukin-6. These are very inflammatory markers. As a matter of fact, if you go to your doctor and you're not feeling well or you're having a tough time with COVID, you really want to test TNF-alpha, interleukin-6, D-dimer, ANA. You also want to test Th1 over Th2. You want to look at some of these more inflammatory markers. So the idea is if you have a late immunometabolic inflammatory change, if that change persists, it typically contributes to long COVID. Now, the idea of long COVID, or once again, post-acute sequela of COVID-19, there was a study with almost 75,000 people that were positive with COVID-19 that were not hospitalized. They studied them and looked at them from month 1 after the positive test through month 6. Now, in that 1 month to 6 month time period, that group of people that were positive for COVID-19 had a 60% increase in death versus the groups that were not sick, not a 60% marker of death in the group, but that group versus regular. So death was increased, 20% greater chance of needing an outpatient medical care. And that's one of the things that I really want to let everybody know. You really need to take care of yourself to avoid COVID. If you have COVID, you really need to help yourself in keeping your immune system strong and imbued with mitochondrial function. These COVID-19 survivors experienced new medical problems. Some of the more common ones were lung issues, neurological, cardiovascular, gastrointestinal. That's a big takeaway. We want to talk about that a little bit. Mental health also. And I can tell you anxiety, sleep. I would have to say that, and I've talked to a few of my friends and a few of my practitioner friends, and we all agree that we see a lot of the population a little on edge. And I get it because our routines have been broken. And as humans, we are very used to a certain routine. We're habit forming, and the break of routine makes us a little unbalanced. And I can see the uncertainty, the little bit of anxiety, maybe even a little bit of anger. So I get it. My routine has been broken. I understand it. So everybody, tomorrow is a better day. Also, in another study on PASC, there was about 3,800 participants, and they were confirmed as suspected of COVID-19 through 56 different countries. There was a prevalence of 203 symptoms in 10 different organ systems. It actually averaged out to about 14.5 symptoms in 9 different organ systems. The number one post-COVID condition that most people talked about, to the tune of about 80%, was fatigue. And I'm going to go into a little more detail why fatigue is a number one marker of post-COVID. Also, they had malaise, post-exertional malaise, to about 73%. Cognitive dysfunction was almost 60%. Sensory motor symptoms was about 55%. Headaches was about 55%. And memory loss was over 50%. Again, I've mentioned multiple times, my mom, older, 92 now, there's a distinctive difference in post-COVID-19, a distinctive difference. Many of the people that I asked post-COVID-19 that are in my age bracket, in that middle age bracket, if you will, have really said that they're having a little trouble learning that second language and things like that. So the memory, the acuity is definitely decreased post-COVID. Now, why is this long COVID occurring? Well, it's interesting in that there's a persistent viral reservoir. There's a residue. They call it a viral ghost. Fragments of the virus, RNA proteins that linger after infection have been cleared, but there's still that residue is still capable of stimulating the immune system. So you're getting autoimmune response truly induced by the infection. The idea that long COVID, this virus is so unique, it's a viral ghost. More so than that, you're seeing that if a person has more than 5 different symptoms, cough is 1, nasal is another, headache is 3, aches, fever, those are 5 symptoms. The individuals with long COVID are at a higher risk of cardiovascular disease and respiratory abnormalities. You're seeing people that have more symptoms have a higher incidence of COVID-19. In a follow-up study, in reference to COVID-19, long COVID-19, 431 participants. This was in July 19th, 2001. There was 26% of the people reported that they were not fully recovered from all the symptoms they had during their COVID-19 6 to 8 months after the initial diagnosis. In this study, 55% of them were long hauling, and it just was pertaining to fatigue. 25% had a shortness of breath, and 26% had symptoms of danger. Remember, I talked to you about fatigue being the number one issue? Here it is in a nutshell. Our immune system. Our immune system needs over 50% of all our energy, our mitochondrial energy, to fight off a pathogen or fight off a virulent virus like COVID or SARS-CoV-2. So it's very interesting that the mitochondria senses this, and it's called a cellular danger response. So our cells must maintain a certain level of energy for our cellular homeostasis, the ability to make energy. If there's a drop in the energy, our mitochondria senses this as a threat. That results in mitochondria changing its primary function from energy production, the powerhouse of the cell, to a cell defense. So you shut off all your energy production. You're using more and you shut it off. They call that a cellular danger response. That cellular danger response, coupled with the fact your immune system is using so much energy, gives you massive fatigue. And here's one more little gem, if you will. Your mitochondria, your powerhouse of your cells, interestingly enough, come from bacteria. They have a direct correlation with your gut. And again, when your gut is damaged or your gut isn't functioning, you will get fatigue. So it has this tremendous cascade. But the real reason that your mitochondria shuts off under attack is a cellular danger response. Another thing that really came out that's interesting is that people with long COVID have a reactivation of Epstein-Barr. Epstein-Barr, everybody remembers that when we were all teenagers, mononucleosis. So many long COVID symptoms may not be a direct result of SARS-CoV-2, but may be the result of COVID-19 inflammation-induced Epstein-Barr reactivation. There's a tremendous cascade of what's going on inside the body because of this virus. You know, our body is an interesting organ in that the body's all interconnected and the body's always searching for homeostasis, and it has different signals. And this idea, this virus seems to really be what I call kicking the grass and waking the snakes up inside our body. So kind of talked about the problem. When I went to chiropractic school 25 years ago, I remember an instance where I came in to complain. One time in 4 years that I complained. And in that complaint, my clinic director said to me, Intern Silverman, never make a complaint without giving an answer. So always have a solution. So let me share some protocols with you. So let me give you my long haulers protocol. Number one, let's look at gut health. Without question, the data indicates that you have to shed the virus. You get rid of the virus and it goes through the gut. Now, what we found in that process of shedding and going through the gut, it can cause something called a leaky gut. 80% of your immune cells are in your gut. It's where your macro and micronutrients are absorbed. Now, here is, if you can look at the top part of my gut, of my hand, would be the inside of your gut lining. And here, the back part of your hand would be the bottom part of your gut lining. There's something here called microvilli. Those are critical for digestion. And the part down here would be called your immune system. If this is my gut, it opens up, your tight junctions open up because of a protein being expressed called zonulin. You're going to allow that virus, which you're trying to shed, to go through. What we've seen is a twofold issue. Fold number one, that in the shedding process, if you don't have a really strong gut, you may give yourself leaky gut and those tight junctions are open and the virus will go into your bloodstream, stimulating the immune response. If you already have leaky gut, and I can tell you, speaking to a lot of my colleagues in the testing in my office, most people, not all, but many to most people have a leaky gut. That virus goes through because you're trying to shed through our own natural process of getting it through our immune system and our gut. We're actually reactivating, reinfecting, or infecting ourselves, even if we have what we call an immune system and our immune system is functioning. It would have to function appropriately. So all about gut health. So adhere to what I call my 7R program, where in those 7Rs, you're really pointed at starting at resetting your lifestyle, taking you through the cascade to fix your overall gut health. Anybody interested? DM me, put 7R. If you put 7R, I will add my protocol into the thread. Everybody can share. So if you're interested, it's called 7R. Now, mitochondrial support. I'm going to have it in the next 2 or 3 minutes. I'm going to share a mitochondrial support. But the key component is to have a mitochondrial support, imbue the mitochondria with its ability to make energy and activation, and also appropriate immune activation. When I talk about appropriate immune activation, I'm talking about balancing the immune system between the innate immune system and the adaptive immune system. And one of the key components is to manage and modulate inflammation. And how can we do that? Well, let me give you some for instances. I have a patient of mine, great guy. He is without questions very concerned about contracting COVID-19. And he's done vaccines. He does all these immune stuff. And that's great. But I told him, my friend, you've got to take care of yourself. The host has to be healthy because you can't control the virus, but you can control the host. You got to stop eating ice cream. Got to stop eating hamburgers. Got to stop eating hot dogs. So you want to manage and modulate inflammation by decreasing your obesity, get a good body fat. Blood sugar, insulin resistance. Goodness gracious. If you had to do one test, one blood marker, insulin markers, big shout out to my good friend. Nobody knows blood tests better than my friend, Dr. Lauren Marks. Blood sugar, without question, would be a critical component. There's a direct correlation between the incidence of higher levels of insulin and insulin resistance and the positivity of COVID-19. They are without question interrelated, and you always want to keep your body in an anti-inflammatory status. So here's the protocol to improve mitochondrial function. Obviously, improving mitochondrial function will decrease fatigue. You want to make NAD+, you can do so by taking a supplement called NMN. You want your plethora, if you will, of B vitamins. B1, thiamine, a critical element. A lot of good information on how thiamine is a great immune enhancer, also great for the mitochondria. Coenzyme Q10, great choice. L-carnitine, alpha-lipoic acid. Alpha-lipoic acid works with the water in the fat part of cell. Glutathione, which is the master antioxidant. PQQ, mitochondrial mesylate. And the minerals that I would recommend would be zinc, selenium, magnesium, vitamin C, and vitamin E. That would take care of the mitochondrial function from a supplemental form. Of course, always eat organic foods, your fruits and vegetables, good plant-based. If you want immune activation, mushrooms, reishi, maitake, lion's mane, shanga, shiitake are great choices. Lifestyle. Number one thing I would recommend in lifestyle is intermittent fasting to help your mitochondria. Intermittent fasting, eating within a framework of fasting and feeding. So I'm a big believer in most patients, they should eat between an 8 and a 10-hour window. The fasting allows you to have something called autophagy. Autophagy is the breakdown of old cells using the debris to make new cells. As well as autophagy, the key component is mitophagy. Mitophagy is the breakdown of mitochondrial cells, but greatly making new, more efficient mitochondria. The difference is breaking down the raisin and making it look like the grape. Also, autophagy and mitophagy allows you to have immunorejuvenative cells. So it's really a trifecta to allow you to avoid that sequela of COVID-19. Now, after intermittent fasting, I'm a big component of keeping, if I'm going to eat some carbohydrates, the glycemic index, the sugar level down low. Don't eat any processed carbs, no processed food. Eat only good fats, good quality proteins, amino acids. Get sleep, exercise, get moving. You know, they have what they call a core four. Exercise is at the top of the list of a core four. Core four would mean exercise for 150 minutes per week. It would mean eating in the top 10% in America, having a low body fat, an appropriately low body fat for your age and gender, and not smoking. With those four criteria, only 3% of Americans hit those criteria. 3%. The other thing I would recommend would be low-level laser. I'm a big proponent of electromagnetic transfer of energy. Nothing works better at helping the mitochondrial function and allowing homeostasis in the mitochondrial communication. And, you know, detox. I think detox is a great choice. You would want to detox specific toxins. By detoxing, I think that we've got a great idea to help the body, because it's all about allowing our body work to help ourselves in this time of need. Now, I see a whole bunch of things. I know Steffi stood up. I was going to answer questions. So let's go. What do I've got? I've got Roberto. Hello. Now, nobody does it. Nobody messages better than my friend Roberto Monaco. Anytime anybody needs anybody to teach them how to feel comfortable, like myself, helped me a lot in front of camera, he's the guy to go to. Ken, hey, Dr. Ken, how are you? Great hearing from you. Really appreciate it. See a whole bunch of seminars. Anybody who's interested, please do me a favor. Share this. This is incredibly important information. So many people ask about it. I'll be back. I'll be back on tomorrow. I'm going to be back on social media, sharing nuggets. You know, I saw a 90-year-old doc today. He was great. He did a video. He's a researcher, and he said, in research, all you really do is stay in the wall. And there's a point to the story. You stay in the wall. You work with the rodents and everything. But he was so enthusiastic about sharing his findings and still working at 90 because he was able to make a difference. And that's why I'm here. I'm going to make sure I'm sharing with you. I'm going to make sure I make a difference. Anything you need, feel free to reach out. I'm Dr. Rob Silverman, always yours at help.